Okay, welcome today to our panel of audiologists. My name is Betsy Beach. I live in Providence, Rhode Island. I'm a commissioner on the Rhode Island Commission for the Deaf and Hard of Hearing. I've been a commissioner for 10 years, and I'm presently secretary. I myself am severe profound deaf. I wear 2 high-powered hearing aids. I've been deaf in 1 ear pretty much all my life, and my second ear started failing me about 15 years ago. And with all this, I've been able to be active. I'm the president of the State Association for the Hearing Loss Association of America. I teach adults that are doing job training programs. And I advocate for things that will make the lives better for people who wear hearing aids. So things like hearing loops and just general consumer information about that. And I'm really excited to welcome our panel of audiologists. And I'm going to start with Tina. And I would like you to just introduce yourself with your full name, your job title, where you work.
So, hello everybody. My name is Dr. Tina Childress, and I am an audiologist. I have a variety of employers. I work half-time as an educational audiologist in the mainstream school setting. I'm also a consultant trainer for the Illinois School for the Deaf. I live south of the state of Chicago. I also do some adjunct teaching at the University of Memphis, and also my alma mater, the University of Illinois. Lastly, I do some professional speaking on a variety of topics, but especially assistive technology. That's kind of my jam. And I also create and share resources on social media. I guess I should also mention that I am a late deafened adult, and I have bilateral cochlear implants. And I am also fluent in ASL, but I thought it would be best if I just kind of sit on my hands and let the interpreter do her job.
All right, we'll go next to Sara Carnevale Fearon.
I'm Dr. Sara Carnevale Fearon. I'm an audiologist here in Rhode Island. I own my own private practice, Rhode Island APD and Hearing Solutions. I do a lot of auditory processing testing, as well as hearing aids and assistive devices and that kind of thing. So,
thank you. And Lachelle Lazarus next.
Hi, everyone. I'm Dr. Lachelle Lazarus. I am an audiologist located in Baltimore, Maryland. I work at the University of Maryland Medical Center. I have been here for about 1.5 years now. My specialties are tinnitus and vestibular disorders.
Great. And finally, Sarah Sparks. Welcome.
Hello, everyone. I am Dr. Sara Sparks. I am an audiologist based in Washington, D.C. I have 2 jobs currently. One is I have an online business called Audiology Outside the Box, where I provide online audiologic counseling, oral rehabilitation, tinnitus management, and general education about audiology. I also work part-time at the Gallaudet University Hearing and Speech Center, where I provide cochlear implant, hearing aid, and some diagnostic services. And like Dr. Childress, I am also deaf. I'm deaf due to progressive hearing loss. I use 2 cochlear implants, and I communicate daily in both English and American Sign Language. But because English is my native language, I'm choosing today to speak English.
Okay, great. We'll go on, and I'm going to ask what inspired each of you to work in the audiology field. So, and we'll do the same order. So Tina, you go first.
So, well, actually, it was an accident that I found audiology. I was a computer engineering major first, and I decided that it was not something that I was interested in. So I took a sign language class. And ironically, that introduced me into the speech and hearing science building. And I learned about audiology and fell in love, and I've never looked back.
Great. And how about you, Sara Carnevale Fearon?
So I also stumbled upon audiology kind of by accident. I knew I wanted to go into a medical helping type career. And I took one of those interest indicators they make you take in high school. And it came up as my #1 career match to be an audiologist. And I didn't even know what it was. So after a lot of research, I was like, oh, wow, this is a good fit for me. So that's how I ended up in audiology. And I really enjoy what I do.
Okay, good. And on to you, Lachelle. Thank you.
So for me, also, I didn't do a communications background. I went into undergrad wanting to be a pediatrician, actually. But then I realized, the med school route, I didn't want that. The work-life balance wasn't very existent in that pursuit. So I decided to change my direction. However, I still wanted to be a part of healthcare. I wanted to have the opportunity to work with pediatric patients if necessary. So I changed to do career counseling, and I did a lot of personality tests and things like that, and audiology came up on my list, and I knew a few audiologists, so I talked to them about it and shadowed them. I had ear infections as a child, so something that I was sort of familiar with, and it just seemed like the scope of the field was something that I could excel in and be interested in. So in learning more about the hearing and the balance systems and the intricacies there and how fascinating it is, I decided to make that commitment. And that's how I became introduced to the audiology field. And I don't regret it at all. I enjoy it greatly.
That's great. And finally, Sara Sparks.
So audiology is a second career for me. I had an 8-year career as a religious studies teacher before changing to audiology, before starting an AUD program. I started to get this sense toward the end of my career as a religious studies teacher that it was a temporary calling in my life and not what I was meant to do permanently. And either fortunately or unfortunately, depending upon how you want to look at it, I had a bout of chronic illness where I needed to take off work for a year. And I spent the time just really thinking about, what do I want to do with my life? What do I think I'm meant to do going forward? And the more that I thought about it, the more audiology just made sense. It always bothered me that when I saw audiologists as a patient, no one was ever able to sign with me when I had my hearing devices off. And that was something that I thought would be really good if audiologists would be able to do. And also, I was really interested in the vestibular system and how balance may affect different aspects of deaf and hard of hearing people's lives. So those are the two things that got me primarily interested in audiology. So I started taking some online prerequisite courses to see if I would even be interested in pursuing an AUD, and I loved them. So I applied for AUD programs. I got into Gallaudet, which is where I wanted to go, and everything else just fell in place.
That's great. Thank you. All right, well, we'll go on and we're going to talk about one of the big challenges of today that we've been facing lately, which is the pandemic and COVID-19. And how have you noticed that people with hearing loss have been doing during the pandemic? What challenges have they faced? And do you have any tips for hard of hearing people in this particular time? And we'll start with Tina again.
So we know that masks and social distancing make it harder for everybody to hear, but especially for people that are deaf or hard of hearing. And if they rely on lip reading cues or speech reading cues, we know that it makes sound softer. We know that it will take away some of the higher frequencies, which is where the consonant sounds are located, which will just make everyone sound like they're mumbling. And so what I think is really important for consumers to know is that there are options to hear better. There are assistive technologies that are constantly evolving and being developed and being created. And it is hard to kind of keep up on the latest and greatest. We know things like Zoom and Google Meet and WebEx and all of those kind of platforms are also constantly updating and coming out with more features. You know, we have great advocacy and consumer groups that are really kind of pushing for these kind of platforms to be more accessible, not just for people deaf or hard of hearing, but, you know, for all different kinds of disabilities. And so as a consumer, I think it's really important that you kind of know what your options are, talk to your audiologist, talk to other consumers and peers that are deaf or hard of hearing to see what maybe they're using and what has been successful for them. In terms of tips, the first thing that I think not all consumers know about is that, especially for hearing aid users, it is possible to get what we call a mask program, where, you know, it's something that you might use when you go out into the community. It makes sounds a little bit louder. It will emphasize some of the higher pitches that you're missing because the mask is taking them out. So talk to your audiologist about that option. You know, investigate what kinds of assistive technologies that are out there. I'm talking about things like speech to text apps. I'm talking about things like remote microphone technologies. I also know, as a bilateral cochlear implant recipient, it is really tempting when we're working from home more than we ever have before to kind of go like ears off. I call it deaf o'clock. And I noticed that there were kind of lengthy times when I decided I just, you know, I'm not really talking to anyone. I'm just sitting in front of my computer. But I do notice that when I do put it on, it takes a while for my brain to kind of like reprocess how to hear again. And so know that that's something that's very common. You know, you're not stimulating your brain auditorily, so it just takes a while to warm up again. Definitely join up with groups like HLAA, like ALDA, like NAD for peer support and resources. You know, I know some people have really had to fight for access in the workplace. You know, we're still kind of making this up as we go along, especially employers aren't really sure how to provide access, but that's your right. That's your right as an employee to have accommodations, so seek that out. I think also as a consumer, it's really important that you figure out what I call your elevator speech. You know, being able to tell someone, this is what works for me, this is what I need from you, instead of them kind of like, well, I don't know what's going to work for you, or I'm going to give you this accommodation, and maybe that's something that's not appropriate. So figuring out what your elevator speech is very important also.
Thank you so much, Tina. I'll have to practice it. We'll go on to Sara Carnevale. Fearon, your thoughts?
So, as Dr. Childress just mentioned, the distance and the masks are a huge problem for those who are deaf or hard of hearing, because we're taking away all of your lip reading and we're reducing the volume, especially in those high pitches, by quite a lot, depending on what the mask is made out of. I've had good luck here in my clinic using a clear mask, which allows my patients still to do some lip reading. I have one patient who is deaf and hard of hearing, and she called me up and she was coming in for an appointment and said, can I bring you a clear mask or do you have one? And I thought, well, that's a really great strategy. So if you are someone who is going to a doctor's office, going somewhere where you know communication is going to be difficult, buy a thing of clear masks and bring them with you, and advocate for yourself and say, here, we're going to communicate. I need you to wear this. I thought that was very effective for her. The social isolation is also a big issue, because we are relying so much, like Dr. Childress was talking about, on Zoom and telephone conversations, much less on the person to person. We're losing our connection to people, and that can really affect your mental health. So that's something you want to keep an eye on if you're feeling like alone and depressed. There's lots of groups. Dr. Childress mentioned them all. We have an active HLAA here in Rhode Island. You can reach out. There are people who will, who are willing to communicate with you. So don't be afraid to ask your audiologist for help in that. The other big thing that I think is worth mentioning is that people are losing their hearing aids and their devices like crazy when they take their masks off. It is a huge problem. So you have options with your mask where you could tie it behind you, get a different kind of clip, a clip to go behind you so you're not pulling off of your ears. Some people are using like the gaiters, but there's been some controversy about how well they prevent the COVID virus from coming out. So look into different mask options. Don't be afraid to ask for help. And if you lose your device, there are options as far as insurance and that kind of thing. If you're something you're really worried about, there's several different companies that will insure your hearing aid if it's no longer under the warranty from the manufacturer.
Great, thank you. Okay, we'll move on to Lachelle. Thank you.
So, just kind of piggybacking off what was said, I think the greatest difficulty is the masks, the use of the masks. It's really taking away those visual cues that a lot of individuals who rely on that are struggling with. With my specialty being tinnitus, what we see is there's a lot of correlation between people with hearing loss and people who suffer from tinnitus. Now we see that with tinnitus, that ringing in the ear, it can be more bothersome under periods of stress. COVID-19 this year has been a year of overall stress for many reasons, for many different people. Because of this, we're seeing a greater amount of individuals who have hearing loss come to us that are bothered by their tinnitus. And this has been a significant increase in those individuals over this last year. So this has been something that we've been introduced to here. And then even beyond, with the isolation, individuals who have hearing loss, they naturally isolate themselves, given the fact that they can't communicate optimally as they maybe once used to. So what happens now is that there's even more isolation. So it's kind of adding upon that. So for patients that are already struggling with that isolation, now you're told, to stay away some more from your family and friends. Another issue that I've noticed over this past year is there are a lot of elderly patients who have hearing loss. And because of the guidelines to stay outside of clinics and not travel and things like that, it's been hard for us to service these adults in an optimal way because, as recommended, they're not able to come into the clinic. And then add on to that, telehealth kind of boomed up this last year, but unfortunately for our older population, they're not as savvy as our younger population in regards to telehealth. So there's another layer of difficulty that we're noticing there for individuals with hearing loss during this time of COVID. Some tips, just piggybacking of what was said, advocating for yourself, buying those masks that have the clear screen around the mouth so that you can get those visual cues. And also another thing is being aware of the acoustics of where you're having these conversations. Now that people are told, you can now gather outside, things like that. If it's a windy day, you may want to go to the corner of the home instead of out in the open field, because that's just going to be a bit harder for us to understand what's being said. So even though, we're not really in those restaurant environments right now, there are still difficult listening situations as we take our walks and get back with family that we have to take into consideration. And another thing is, we talked about Zoom calls, and we talked about how there's all of these opportunities to connect over screens. If you are using a device that has the capability to connect to these screens, whether it be via Bluetooth or any kind of intermediary device, use that in order to get better understanding, optimal understanding from what is being said over that screen. And if closed captioning is necessary, contacting that meeting director beforehand, talking to your family members. Can we see if we can incorporate some closed captioning? There's great apps out there actually that can be used for closed captioning. So even as you're talking to your family members over a screen, having that app just set up right by that screen to pick up what's being said and to be that closed captioning in real time for you is going to be very, very beneficial. So those are some of the issues and the difficulties that we see during this time, but also some of the tips that I can suggest.
Thank you so much. And Sara Sparks, on to you.
Everyone has made such amazing comments so far. I agree with everything that has been said, and I don't want to be repetitive of what's been said. So I'll just add a few things in addition that I thought of. One is with regard to deaf and hard of hearing children, particularly those who have been in classes online rather than in person. And some schools are now starting to transition back in person. So there are issues with that as well too. But one thing that I have noticed with clients that I've worked with is that many parents and children have had difficulty with getting schools to provide the accommodations that their child actually needs, rather than an accommodation that is not appropriate. So for example, I've had families who have said, well, the school is willing to turn on the auto captions for Zoom, but they're not willing to pay for CART anymore because they think that the auto captions are just as good. I would encourage parents and older children who can advocate for themselves as well to advocate for your rights. You are entitled legally to accommodations that work for you rather than accommodations that someone else decides will work for you. So learn a bit more about your legal rights. There are great resources online for learning about what you are entitled to under the Individuals with Disabilities Education Act, the Americans with Disabilities Act, and Section 504 of the Rehabilitation Act. So becoming more aware of those things is something very important that you can do as a consumer during this time. In addition to that, be aware that your child can still have educational audiology services even if they are having classes online rather than in person. That's not a service that is limited to in-person classes. If your child is deaf or hard of hearing, they're on an IEP or a 504 plan, absolutely, they can have educational audiology services. So continue to advocate for that for your child. A little bit more on the issue of cochlear implants and getting enough wear time during the day. That's something that I've definitely struggled with myself as a cochlear implant user, because my typical pattern is to use my implants during the workday, but then go off when I'm at home just for some relaxation and switch to ASL. And I think that that's fine if that's a pattern that works for you personally, if you have your own use pattern, but things have changed now that we're at home a bit more rather than being out in public. So I have had to be a lot more intentional about planning time to make sure that I am using my implants so that I don't experience a significant change in my cochlear implant hearing by the time that we all get out and are in person more often. So I would encourage cochlear implant users, if you're struggling to use your implants while you're at home, to still try to get that use time in and to make a schedule for yourself if you're having trouble making sure that you actually get enough time in. So that is something that I would add. And then also, I just can't emphasize enough the importance of community and having other people around you to avoid social isolation. There have been great resources mentioned so far, like the Hearing Loss Association of America. Another good one is the Association of Late Deafened Adults. You don't actually have to be a late deafened adult to participate in that organization, and they have some really good community groups in different places, in addition to having an annual conference. So that is a good resource as well. The cochlear implant manufacturers also have people that you can reach out to who use their products, who can be supportive of you as a cochlear implant user of the same products. And these folks are experienced cochlear implant users who are great at providing mentorship and providing support. So that's a good resource. Also, Gallaudet University has a peer mentor training certificate program. It's a professional studies certificate where deaf and hard of hearing people can be trained to become peer mentors for people who are later identified to be deaf or hard of hearing. And generally, it's aimed at providing mentorship to late deafened adults, but the peer mentors who have graduated from that program provide services in all kinds of areas. So if you reach out to the people who are currently in charge of that program, they can help you find someone who might be in your local area who has completed that program and who has a lot of training on how to mentor. I actually used to be the instructor for that program myself, so I can attest to how wonderful it is. So those are the things that I would add in addition to what has already been said.
Thank you, everybody. I think that for the next question, it was about what information and resources you offer about new technology to your clients. And we've talked a lot about that. So just if you have anything additional to say there. And also in particular, Rhode Island's made a big effort recently to provide hearing loops in libraries and state facilities. And so do you discuss hearing loops with your patients or clients? Do you discuss what is involved there? You know, like having a telecoil and how to access that kind of thing. So we'll start with Tina. Anything about technology here?
So I'm gonna say something first about the previous question, and that has to do with masks. So, you know, there have actually been a lot of studies looking at the different kind of masks that are out there, the paper and the cloth masks versus the masks with their clear windows versus the face shield. And what I want consumers to know is that all masks function a little bit differently, and what may work for one person may not work for you. And that's something that you need to figure out. The masks with the clear windows actually make it harder to hear because acoustically the sound can't get through the plastic as efficiently. When people are wearing face shields, and especially in things like clinics and hospitals, they actually have to wear like an N95 mask and a face shield. And essentially what you're doing is you're adding like a 20 to 30 dB hearing loss on top of the hearing loss that you already have. And so I feel that like for me, I actually had some testing done where my coworker tested me, and I do very well with just the paper mask or the clear mask, but I really, or with a cloth mask, but I really struggled with, for sure, the shield, and even with the mask with the clear window. And so just be cognizant of that. It's not the solution to everything. If you rely on hearing more than you rely on visual cues. you may find that you actually do worse with a mask, with a clear shield, with a clear window than you would with a cloth or paper mask. So that's one thing. In terms of going back to the question now about technology, especially with hearing loops, for sure, HLAA, Hearing Loss Association of America, is always my go-to for information. They have someone very dedicated to promoting hearing loops. They have, great resources like where to find a hearing loop in your community. You enter in your address and it'll find venues that have hearing loops. It'll talk about how to advocate for hearing loops. One thing though that I think we also still need to remember is that not everybody can benefit from hearing loops. There are some people that their hearing is such that even with amplification, even with remote microphone technology, just their auditory system is still not able to process enough for understanding. So to always also think about things like captioning, and to think about, asking for an ASL interpreter if you feel that's something that can help you. So, but in terms of hearing loops, definitely HLAA. If you are a college student or thinking about going to college, my favorite resource for finding about accommodations and your transition plan and possible technologies for sure is the National Deaf Center. They have fantastic resources and planning guides.
What center? I'm sorry.
Oh, sorry, I thought I heard something. And so I've actually worked with them on some of their technology kind of modules. And Sarah Sparks, Dr. Sarah Sparks, who's my friend, she kind of like talked about educational audiology, which is what I do. She also talked about ALDA. I'm the secretary of ALDA. Why am I not mentioning this? Thank you, Dr. Sparks. And so, there are great resources out there. Your educational audiologist for sure should be able to help you figure out the best way to connect to your device as well. And so personally, because assistive technology is something that I love to learn about and teach other people about, and then share resources, I do have a blog and a bunch of resources, YouTube videos and things like that, that will describe, how to use these different technologies. And so I'm not sure, Betsy, if we're going to be able to share some links with this webinar, but I'd be happy to provide that information to you that can be shared as you share this video. But I know that that's something that I do, and other people on this call also do. So I'm always happy to share that information.
That would be wonderful. And can you say that the name of the center again that you recommended for the students?
Sure, it's called the National Deaf Center.
Okay.
Yeah, it used to be known as PEPNET, and then their grant kind of changed, and so now they are known as the National Deaf Center. They're based in Austin, Texas.
Okay, thank you.
You're welcome.
We'll move on to Sara Carnevale Fearon.
All right, so beyond the regular technology of just like hearing aids, making sure you're seeing an audiologist that lets you try some different technology before you purchase something, which is very important. You should be able to try it before you're committed to anything. In Rhode Island, we have a really awesome program. I think it may be run by the commission. It's at least run by the state, called ATEL, where you can go try the phones and other kinds of assistive devices, and they'll help you purchase them. They'll lend them to you. So if you are needing some assistive technology beyond hearing aids, you're looking for extra, that's definitely a program that's worth checking out. They actually have a place to go in Warwick where you can try them out and see what works for you before you purchase something. So I always recommend that to my patients if they're looking for extra assistive devices. And I do recommend that people consider a telecoil unless they want a really small device. That's one of the biggest drawbacks to getting a really small hearing device, is you are giving up that option of being able to use a loop. If that is something that would benefit you, which, is something you should discuss with your audiologist. They should be able to tell you if that's something that would be helpful to you or not. So those are two big things that I try to be sure to do with my patients. I do have like the hearing aid companies accessories to try as well in the office, if that's something that would be appropriate for you as well.
Thank you, Sarah. And on to Lachelle Lazarus. You're next.
Yes, all great suggestions. I totally copy what they have said in regards to referring to different organizations that have these resources in regards to like HLAA, excellent resource to just forward a patient to do that navigation to find out which technologies would be best appropriate for them. The telecoil, just as was said, you know, unless a patient wants a very, very, very tiny device, then the telecoil is a great addition for the hearing aid. And it doesn't change, you know, the size of the standard hearing aid. So it's just something nice to just kind of throw in there for the patient to have. And then, you know, there are all the other nuances for nurses. You can get hearing aids that with a middle intermediary device can connect to stethoscopes, things like that, that can be unique for a particular patient and their occupation. So those recommendations that were stated before, I just kind of hop on that, and I agree.
Thank you so much. And lastly, Sarah Sparks, you're up.
Again, everyone has given such wonderful answers thus far, so I'm just going to try to add a few things. For one, I want to emphasize a point of Dr. Childress's again. Hearing loops are not necessarily appropriate for every person. Your audiologist should be able to give you a sense of whether it might be helpful for you. And if it is something that would be helpful for you, make sure before you buy new hearing devices that they actually have telecoil in them, because some newer hearing devices do not have telecoil in them. And it's something that might not necessarily be mentioned to you by the audiologist if you don't bring it up yourself. So I would suggest when you are in the process of getting new hearing devices, if you're not already using a hearing loop, ask your audiologist, do you think I would benefit from using a hearing loop? And if the answer to that is yes, then ask, could I see only hearing aids that have telecoil in them? You know, I'm interested in using a hearing loop. I want telecoil in my hearing aids. So definitely bring that up when talking with your audiologist. And also the other accommodations in addition to using hearing technologies is very important. I just want to point out that right now, even though I am speaking English, I am getting what everybody else says receptively through the ASL interpreter. I think it's a common myth that you have to choose either hearing technologies or sign language. And that's something that I would like other people to understand. I think it's important for consumers to understand that these two things are not opposites of each other, that you can make use of both things and they can both make very meaningful contributions to your life. So it's okay to use something like a hearing loop at the same time as you are getting ASL receptively. This is my telecoil loop that I'm listening through right now at the same time as I'm watching ASL interpreter. So that is something to keep in mind. And also there are great resources online for learning more about these different kinds of hearing technologies, the ones that are manufacturer proprietary, as well as ones like hearing loops that can connect to any hearing device with T-coil. Dr. Childress on her website has an amazing list of assistive technology resources and apps. I have a few of those listed in a resource page with Audiology Outside the Box as well, but not as many as Dr. Childress has. So definitely check out her website as well. See here, Communication Matters. So I would recommend that. And again, I would just emphasize being open-minded about what might work for you that you haven't tried yet, definitely ask around other deaf and hard of hearing people, ask your audiologist, ask others in the community who might know about new technology options that have been effective for them. And then lastly, I would say, keep in mind that assistive technologies that are helpful for deaf and hard of hearing people are not just auditory technologies. Things like visual smoke detectors, vibratory alarm clocks that you can use. All of those technologies are also really important in my life, and they can make an important contribution to the quality of life for other deaf and hard of hearing people as well. So when you're looking for technologies that might be supportive of your needs, don't just think about communication, also think about other aspects of your life where due to being deaf or hard of hearing, you might need to do things a little bit differently than hearing people.
Great, all good information. Thank you all so much. Okay, so on a state level, how would you like to see any state commission of the deaf and hard of hearing, such as the Rhode Island Commission for the Deaf and Hard of Hearing, work to improve the relationship with audiologists and their patients? Thank you.
Oh,
I'm
no
sorry
problem.
to interrupt you.
No, that's okay.
Okay.
When I talk to professionals, I often recommend that they consider going to something like a consumer conference, like an HLAA conference or ALDA or a chapter group meeting or something like that, because it will blow your mind. You will learn, I learn more about assistive technology, I feel, at those conferences than I do at audiology conferences. You'll see the latest and the greatest. You'll see vendors that are, deaf and hard of hearing focused and not always about hearing, and they really do think outside the box. So thinking about Dr. Sparks and the name of her organization. And so I appreciate that, as well as the emotional and social support that you get from going to consumer groups. So, as a professional, they love it when audiologists come and talk at their meetings, and that's a way also for you to generate patients. If they know who you are and they see who you are, establishing that relationship is golden as a professional. As a consumer, I think it's really important that they, again, know their elevator speech and know how to advocate for themselves. Telehealth was mentioned. And I think one of the things that I've realized during this pandemic is how inaccessible audiology offices can be sometimes. They have, videos that are playing the waiting room. There's no captioning. You go in, and if you're doing telehealth, maybe doing it remotely, that there's no captioning, solutions for the consumers. How do you communicate through Zoom when they're already struggling to hear? And we have things like Zoom fatigue. Do you know how to turn on captions in Zoom? And if you can't, what are some of these other speech to text options like Dr. Lazarus was talking about? I think about audiologists saying, okay, take out your hearing aids and show them to me on the camera, and they keep talking. How is your patient going to hear and understand what you're saying when you're having them take out their hearing device? So we need to be very, forward thinking about that. And even if they do come to your office, so many offices have those plastic shields. So again, it's going to be affecting the acoustics. So, partnering with the audiologist and the consumer to figure out options. And personally, I think for those kind of situations, having some kind of captioning is very beneficial. Some people do benefit from automated captioning, like for me, because I hear pretty well with my implants. If I just miss a word and I look down at the captions, for me, that's fine. But if you're talking about a very complex medical procedure, it would be appropriate to tell the hospital, I need CART, like we have available for this call, to make sure that you're not missing out on information. So I think that's something that is really important. The other thing, I feel like consumers also need to know, what is the name of your device? Can you say that you have the Phonak M50P? You know, a lot of times, you know, they'll pull out their hearing aid, you know, what do you have? And they'll be like, it's a Windex or an Opticon, or, you know, all those crazy names that people come up with for their hearing aids, but not knowing the exact make and model. I use this example. It's like if your car breaks down and you need to talk to a mechanic and they ask what kind of car you have, and you say it's red. You know, that's not going to be helpful. You need to know so that they make sure that they have the right parts. So those are just some of the things that I was thinking about.
Thank you. And on to you, Sara.
So for, at least here in Rhode Island, I think the commission actually does a very good job having resources for people. They've got some really great resources that they even send right to my office on telecoils and assistive technology. And I think that that's really great. I think the biggest thing that the commission here in Rhode Island could do is just advertise themselves a little better. I think if you search hearing aids or hearing loss in Rhode Island, you're going to get like Beltone and Miracle Ear, and not that that's bad, but it's not easy to find the information on the commission and all of the services that they do offer. And I'm not quite sure the best way to make that more accessible to our patients, but I think as far as the state of Rhode Island goes, that's something that we could maybe do better. And even as an audiologist, I only became aware of the commission, and they usually put on an annual convention of sorts after I got connected with the HLAA group. So even as an audiologist, I wasn't aware that was going on until I got connected with HLAA. So I think more communication is really key between all the parties, because there's good information out there, and if we can get it connected to the people who need it, that would be fantastic. Great
suggestion. And on to Lachelle.
Yeah, it sounds like the common theme is the awareness, you know, getting that information out to patients and to establish that relationship. I think that establishing the relationship is that first step to improve the relationship. There's a lot of individuals, a lot of potential patients that don't even know about audiology, and you know, talking to primary care physicians and getting that relationship built as well, to say, you know, we are providers who specialize in this, whether it be, you know, hearing, deaf, hard of hearing, balance issues. We are available for dedicated service for these patients. So I think that awareness is huge in regards to creating these relationships and then improving upon these relationships. There can be seminars, perhaps, that can be done. I'm not located in Rhode Island, but, you know, seminars, and it's hard these days because, you know, we're not supposed to gather, but even using avenues through Zoom and things like that, so that we can give individuals access and information to hearing loss, hearing preservation, you know, assistive listening technologies, things that are available, so that they know that we are professionals that are here for them, and that we want to improve upon that relationship. We want to establish it and build upon it through consistent care with these patients. So that's what I would say in regards to, you know, on a state level, how we can kind of improve that relationship.
Thank you for your thoughts. And lastly, Sara Sparks.
I think that more mutual education opportunities between audiologists and deaf and hard of hearing people would be a very good thing, whether that's through a state commission for the deaf or hard of hearing or another venue. One of the things that I find very frequently, being both part of the audiology community and part of deaf and hard of hearing communities, is that there are a lot of misconceptions among deaf and hard of hearing people about certain things in audiology that partly arise from audiologists not explaining things fully. So I would definitely, I guess getting ahead to the next question a bit, I would definitely encourage my colleagues in audiology to explain what you're doing so that people understand what their hearing test results are and why we're doing the things that we're doing. Because I think it's really easy to assume that, especially if someone has had their hearing tested again and again and again throughout their life, then, you know, certainly they know what their hearing is. Certainly they know this information. But one of the things that I do when I'm working with a new person, regardless of who it is I ask them, has anyone ever given you a full explanation of your hearing test results before? And if the answer to that is no, then the first thing I do is explain their hearing test results to them after I have them. But there are different kinds of misconceptions that come up that I think would be remedied a bit if audiologists and deaf and hard of hearing people had more opportunities for mutual education. An example that I can think of, I very commonly am asked by deaf and hard of hearing friends, why is it that audiologists always use those same words, hot dog, baseball, cowboy, and so forth? Don't they know that if I've had my hearing tested since I was a little child, that I've memorized those words? And then I explain to them, well, we do know that you've memorized those words, and we want you to know those words before that test, because the purpose of that test isn't to count how many words you got correct. It's to find the softest level where you can hear those familiar words that you know already. So those little things, I think audiologists don't always think about. People might misunderstand something and need a fuller explanation of why we're doing the thing that we're doing. And then on the other side of that, audiologists also don't think of certain things that deaf and hard of hearing people think of. One example that comes to mind, when I was in one of my internships during my AUD degree program, I was interning at a place that had a hearing loop in the waiting room connected to the TV so that people who came in with telecoil could listen to the TV while they were waiting for their appointment. But the hearing loop was actually leaking into the booth that was next to the waiting room, and I'm the one who figured it out because I had to have my microphones and telecoil turned on at the same time the entire time that I was in the workday there as an intern, just because of how I listen during the day. So I was the one who figured out that the loop from the waiting room was leaking into the next booth. And it actually affected one of the appointments the day that I figured it out. One of the audiologists had been testing a kid who was saying, I keep hearing music, you know, while the audiologist was doing the aided testing. And the audiologist was like, I can't figure out where this is coming from. And I said, well, it's the loop in the waiting room. I have to turn it off every single time I test somebody in this booth. So that's just an example of something that I wouldn't have figured out if I weren't deaf myself. And it's really important, I think, for audiologists to have those opportunities to listen to the experiences that deaf and hard of hearing people have, because we can learn a lot from those things.
That's a great point. Thank you so much. And I think we have about a minute left for everybody. Just we'll cycle through one more time, and any last words. Thank you for sharing all these great thoughts. We'll start with Tina.
So kind of piggybacking on what, of course, Dr. Sparks said, in terms of audiologists being able to actually explain hearing loss and, you know, an audiogram and things like that. As a teacher, one of the exercises that I have all my students do is I have them, you know, talk about how hearing works, how hearing loss happens, how a hearing aid works, cochlear implant, etc. And I have them write it down verbatim, like word for word. And then they say, okay, now call your mom, call your boyfriend or your girlfriend and read it to them. If they don't understand what you just said, do it again. Because I think, you know, when you're in a field and you're doing the same thing every day, You throw out words like decibel, you throw out words like hertz, and people don't understand really what it means. But so audiologists need to have an elevator speech also in a way that's meaningful and understandable. I think it's also really important for consumers to understand that identical, like audiograms, do not mean identical functioning. Like Dr. Sparks and I probably have very similar aided audiograms with our cochlear implants, but because I was 29 when I lost my hearing, I was already an audiologist. I know, bizarre, versus having a progressive hearing loss or being born deaf. My experiences and my auditory memory is going to be very different, and my trajectory is going to look very different than someone else's. So give yourself grace in terms of saying, well, why are they doing so well with their hearing aids or cochlear implants, and I'm really, really struggling? There are so many factors that go into how successful, and that can be defined in several ways also. And so give yourself grace. Understand that, you know, communicating during these COVID times is going to be difficult. And I do this sometimes when I'm just tired of wearing my implants and struggling to hear. I actually will just go into the grocery store, point to my ear and go like this. And you know what happens? The cashier will do things like point to the amount. The cashier will do things like give me thumbs up, thumbs down. And I wrote a blog post about this. It's like I've taken like the communication burden and I put it on them instead of me going, okay, I see their mask is moving. What are they saying? And it's okay to do that. And people will accommodate you. You know, deaf people, people that have absolutely no residual hearing, have been doing this forever, you know? And so as people that might consider themselves more hard of hearing, understand that that can happen as well. Yeah, and I think that's all I have.
I'll just say you have a kindred soul here. I'm always on mute in the grocery store. And I make sure that my audiologist knows that I want a mute channel. And the other thing I'll just say personally is that if I lose my left hearing aid, I can't function. If I lose my right hearing aid, I can function okay with my left. Somehow my brain needs whatever it is in my left ear. And totally an example of how we're all individuals here, and great points, thank you. All right, on to Sara Carnevale. Last words. Yeah.
So I completely agree about hearing being so unique, and it's not like vision. You know, people think, oh, it's a hearing test, just like a vision test. I'll get my hearing aids and I hear perfect. Hearing aids do not work like that. It's so much based on how your brain processes the sound, and you should keep that in mind. And also you should find an audiologist or a provider who you feel like is your partner, that you can come in and you can tell them what's going on and they'll listen to you and try to help you, because there's lots of resources out there. There are ways that you can be helped. I think that just from this talk today, you've seen there's tons and tons of resources out there for people who are having difficulties, and your audiologist should be able to help you with those things. And if you've got a relationship with an audiologist that's not working for you, it's okay to find somebody that you will work better with. It's, you know, personality. Sometimes you do better with somebody different. It may have nothing to do with their skill level, but how you guys communicate together. You should have an audiologist who's your partner in hearing. You feel like you can trust, and you can come in and tell them, okay, here's what's happening and this is why it's a problem for me, and have them genuinely care and try to help you. So that's what I'd like to say.
And Lachelle?
What I would like to say to both the community and to the professionals in general is to be involved. When you are deaf or hard of hearing, be involved in the organizations that are available to you. Your voice matters, and the same thing as a professional, your voice matters on that state and that national level. So any way that you feel like you can get involved and let your voice be heard. I would definitely emphasize that. And I would especially emphasize it for individuals who are in a minority group. You know, for myself, I'm a Black audiologist, and it takes, you know, you have to take courage and to stand up for yourself when, you know, you feel like you can bring a different perspective to the table. You know, you can represent individuals who may not feel like they have a voice in these spaces. So showing up and being able to teach and to give some insight where insight may not be there. And then as, you know, as someone who's a part of the community, as mentioning using your voice, bringing it to the table when you feel like, you know, these issues aren't being addressed in my community, specifically for deaf and hard of hearing individuals. You know, we can talk about it on a broad spectrum, but there are subcategories when we talk about cultural differences between individuals. So I think that that's something that I would say to the community is be involved, use your voice. We want to learn from you. And also for us as professionals, for us who are minority professionals, to use our voice as well, and to be confident and secure that we deserve to be here and that we can make a positive impact as well. And we can be that representation that we've longed to see for so long. So I would say that it's a bi-directional communication, but in general, be involved.
Great, thank you. And Sarah Sparks, you're on.
Yeah, I cannot emphasize enough what has already been said about people with different audiograms or people with the same audiogram having different functional abilities and different test results on other audiologic tests, and just a lot of differences. It can even be different between two ears. My right and left cochlear implants perform very differently because my right ear has had surgery before it got implanted, and I've had brain surgery on that side. So I don't do nearly as well with my right cochlear implant as my left, even though the aided thresholds for both cochlear implants are pretty much the same on the audiogram. So that's definitely something to keep in mind if you're a consumer or if you're an audiologist. I think sometimes in our profession, the audiogram can be emphasized more than other test results and more than actual functioning outside of the tests that we do, which is all the more reason that it's important for us to explain to people as audiologists what these test results actually mean, that the number of monosyllabic words that they get right on a word recognition test does not mean the percent of speech that they will understand successfully out in the real world. Why is it that we're actually doing this test if it's not for that purpose? And how can they understand more about their abilities out in the real world if that's something that they're not having a full understanding of currently? So I would definitely encourage both professionals and consumers to think beyond the audiogram when we're talking about these issues. And then the other thing I would say as a final comment is that audiology is not only for hearing people. It's not a profession that only hearing people can get into. I know a lot of deaf and hard of hearing audiologists and audiology students who initially did not go into this profession because they thought that it was off limits to them and that only hearing people could be audiologists, but that is not the case. If you're deaf or hard of hearing and you're interested in being an audiologist and you think this would be a good career path for you, there are a lot of good places that you can get support. We have an Association of Audiologists with Hearing Loss, which has a website, and you can see things that have been written, videos that have been made by deaf and hard of hearing audiologists to learn a little bit more about what the experience is like. And there are a lot of us who are willing to mentor deaf and hard of hearing AUD students and students who are interested in pursuing an AUD. It's definitely challenging to get through an AUD program as a deaf person. There are a lot of challenges that I had that my classmates did not have, but it's such a rewarding thing if it is what you actually want to do. as your career. So keep in mind, this career field, this profession is not closed off to you.
All right, thank you all so much. That wraps it up, and feel truly fortunate to listen to each and every one of you here, and I wish you a good day. Thank you.